Yeah, welcome to yet another episode of the Doctor's Tips. Remember, today the topic is more interesting, and remember our guest today is one of the pros in the field of medicine. Welcome, doctor. Yes, so tell us your name, introduce yourself to the show.
Okay, my name is Mercy Mutahi.
Yeah.
I work here at Better Care Hospital, and I'm a general practitioner.
Yeah. So, doctor, today our topic, as we discussed, it's all about syphilis. So tell that person, like most of us hear about syphilis. So what is syphilis according to scientific medical terms?
Okay, according to the scientific medical term,
syphilis
is a sexually transmitted infection. So meaning that we usually get it through a sexual contact.
Yeah, so it's a sexual disease, meaning it can only be contacted sexually.
Sexually, that is orally, if you have sex orally, through anus, or through anal, or through vaginal, penile.
Yeah, so like tell us, like how can one say, like how do you discover, how do you feel like maybe I'm having syphilis? What are these signs that you observe? Then you have to rush to a doctor.
Okay, most of the primary signs that you will see is a chancre. A chancre is a small ulcers. It can appear at the penile or the penis. It can also appear at the vagina, or the mouth, or the anus. So mostly it appears where if you have sexual through the anus, it will appear at the anus.
Yeah, so does it mean like in women and men, the signs are the same thing? Like
the primary signs is the same.
Yeah, and so like now a patient gets to the hospital, how do you diagnose and come to conclusion that they are having syphilis?
Most of the patients do not actually know that they are having the symptoms. At first they'll see that ulcer, it's usually painless. So I won't come to as a patient, you won't come to the hospital because of a painless ulcer. So most of the time they miss until it comes to a secondary. But those who know or who are familiar with, and that's why we are talking about it today for awareness. When you see an ulcer and it's painless, it's good to be checked out by a doctor or go to a nearest hospital and get checked out.
Yeah, what are these secondary symptoms that?
Other symptoms that occur include a rash. You can get a rash, which usually appear 2 to 8 weeks after sexual contact.
Yeah, like now there comes like the steps that the doctors, mostly the medical practitioners, diagnose and come to conclusion that you have syphilis.
Okay, for me to actually think that you have syphilis is I'll ask you about if is that chancre or is that ulcer painless. If you tell me yes, I'll go ahead and check for rash. I can also check about other symptoms like other genital ulcers, and also fever, that is hotness of the body. Most of them comes with it. And then later I'll do a test, which primarily we do a VDRL test. But for me VDRL will turn up positive. But for me to be totally sure, I further do a test called TPHA. A TPHA will confirm surely this person has syphilis. And syphilis, let me tell you, syphilis has primary syphilis, secondary syphilis, and tertiary syphilis. So the primary syphilis, if you miss it, you come with secondary syphilis, but you won't know that you have secondary syphilis because it will appear generalized symptoms. You'll have joint pains, you'll have headache, because it is a multi-organ. It usually affects more than one organ. Then tertiary syphilis is where it affects the nervous system and also affect the cardiovascular system.
So like now a person has been diagnosed, what are there steps of treatment, or just given a medication and you are gone?
There are steps of treatment. That is depending if you have the primary, the secondary, the tertiary. Because most of the tertiary patients, those that have tertiary syphilis, they present us when there was zemo.
So what are these steps? Mainly, we go from primary, secondary, and then the tertiary.
So the primary syphilis, there is usually one dose. You're given a start dose of an antibiotic, which usually clear. That is when or if it's caught early. The secondary syphilis, there is a dose, there is a series of treatment that you'll undergo, but it's an injection and it's usually very painful, so don't get syphilis.
Yeah, for real. In fact, I wanted to come to that. I've had like, if you get any of the STIs, the needle the doctors use to get, it's like a lesson. They use it like a lesson to make sure that it gets. What is the concept behind the painful needle? If I don't know, because is it to make you learn a lesson? Is it what?
It's usually not a painful needle. Actually, it's the drug itself. Yeah, the drug itself. It's usually painful. The injection site is usually very irritated.
Oh yeah.
Yeah.
So you hear if you get syphilis, I'm sure you like it. Okay, so we go to the tertiary steps of treatment.
So let me start with the secondary. Yeah. The secondary syphilis usually have there is a first injection, and then after a month you're given another injection. So actually you'll be coming for an injection because you got a syphilis.
The painful one, or this one is different?
It's still the painful one.
Oh my goodness, okay.
Yeah, the same dose but for a longer time period because the syphilis has stayed in your system for a longer time. So
syphilis is like naturally it usually alters the internal organs mostly, like that's why you are giving the injection.
Yeah.
Does it tamper with the blood system or something?
It does. For the primary to get to the secondary, it's usually through the hemato system.
Oh yeah.
Yeah.
So
that's the blood system.
Yeah, now you're from the second. Now the tertiary.
The tertiary system is usually very severe,
and
most of the damage is usually irreversible.
Irreversible?
Yeah.
Okay.
Because even if it's treated and the damage has already happened at the heart, there's a heart condition or there is a brain condition.
And what are these effects, the effects of syphilis when you are like you contact syphilis? Maybe we are talking the effect in terms of maybe it's primary, the secondary, or the tertiary.
First of it is stigma, which is usually
the stigma,
happens, and people are usually not ready to face it.
Yeah.
So kindly don't go out there and have sex because stigma will be associated with it. Don't have unprotected sex.
Okay. So like now I'm asking the medical or the health effects of syphilis.
The health effect of system.
Yeah.
I've said it's a multi-system.
Yeah, multi-system.
So it affects every organ. So
from the heart, can you get a heart attack from syphilis?
Not usually a heart attack.
Yeah.
No. It's a bacteria that goes to the heart.
Yeah. So you start having heart problems.
Yeah, you start having heart problems. You get enlargement of the heart because the valve are failing.
Oh,
yeah, but not really a heart attack. The valve failure. It's usually affect the valves.
So meaning syphilis can lead to death.
Yeah, when the valves of the heart is usually what holds the blood from pumping the right amount of blood to the system.
Yeah.
So if there is a heart failure,
so I heard also like it causes madness. Is it a concept or is it a myth?
Yeah, it causes madness. When it gets to the brain, that's what it does.
Okay, then like what are these facts that like they make you vulnerable to contract or to get the syphilis? Like what are these things likely to?
Having unprotected sex is one.
Yeah.
With a partner who is not aware they have it. And also having multiple partners because you don't know where you're going to get it. Basically, what exposes you to syphilis is unprotected sex. And when you get you have unprotected sex, you can contact other sexually transmitted infection, not just syphilis.
Now, what would you recommend? Like, how can you control syphilis?
First, it's better to be safe than sorry.
Yeah.
Use a condom. That is, have protected sex. Don't have multiple partners. be faithful to one. The next thing, be aware, because you yourself can be honest with your partner, but the partner is cheating. So educate your partner. If you have the knowledge, educate the partner.
Oh yeah. Now the commonly most asked question is like, do syphilis affect fertility?
Yes, it does. Mostly in the female.
Yeah.
Because as we said, when you have syphilis, you are vulnerable to get HIV, you are vulnerable to get gonorrhea. When you have one sexually transmitted infection, you are vulnerable to get another. So these conditions, mostly in females, you get discharge, they later turns to pelvic inflammatory diseases. Pelvic inflammatory disease, it's a disease which usually affects the tubes. You get tubal blockage. Tubal blockage is the passage of the fertilized, or it's the passage, and it's also the site where there is fertilization take place. So when it's blocked, fertilization cannot take place. The next thing, in men, when you get syphilis, it's also happen you are vulnerable to getting other diseases, sexually transmitted diseases. You get strictures because there is ulceration within the urethra because of that discharge which is untreated for a longer time period. There is stricture, and there is also low sperm production.
So it will affect the sperm count.
Yeah.
So like as a doctor, like what are these concepts that your patients have come up with? Like you try to convince a patient, then but the patient still sticks on the myths of syphilis. Have you come across such?
Yeah, I have come across that.
Yeah.
Most of the male clients, they usually confuse that ulcer with a zip.
With a zip, yeah?
Yeah.
Oh.
They usually say that a zip ilini. Yeah.
Okay. Now, okay. Thank you very much. Now, tell what is that one word or that one advice you can give to our viewer today?
Okay. What I can tell you first, know your status. The next thing about that, have protected sex and be faithful to your partner. And when you're not sure, don't just go. When you're not sure about your signs and symptoms, don't just go to the chemist and buy some drugs. Get to your doctor or the nearest clinic, get checked out. Don't feel demoralized or when the doctor try to ask you a question. Be honest with the doctor. Let the doctor do his work, and probably you may find out that it's not syphilis or it is syphilis and get treated.
Yeah, thank you very much, doctor. That's all for today, the doctor's tips. Remember, next week we're gonna be in the same place, same venue. It's gonna be more sweet. Remember to subscribe to our YouTube channel, that is at Better Care Hospital. Like our Facebook page, that is Better Care Hospital. See you next week. Thank you.